Strokes are a serious and life-threatening medical emergency, but here's something many people don't realize. Strokes don't always look the same in women. Imagine going about your normal day, cooking, working, chatting, when suddenly you feel extremely weak, dizzy, confused, or you start hiccuping uncontrollably. You brush it off. Maybe it's stress. Maybe I didn't sleep well. But what if those symptoms are your body screaming for help? Studies show that women are more likely than men to experience subtle, unusual, and easily ignored stroke symptoms, especially before age 30 and after age 85. And that's dangerous, because every second counts during a stroke. In today's video on GissHealthyTips TV, we're breaking down 10 unusual stroke warning signs in women, why these symptoms happen, what to do immediately, and daily habits that may quietly increase your stroke risk. Stay with us till the end. This information could save a life, maybe even yours. 1. Sudden confusion or trouble speaking. One of the earliest and most common, yet often misunderstood, stroke signs in women is sudden confusion or speech difficulty. A woman may struggle to form words, speak very slowly, use wrong or mixed-up words, or have trouble understanding what others are saying. This happens when a stroke affects the language centers of the brain. Types of speech problems. Expressive aphasia, Broca's aphasia. She understands others, but cannot speak clearly. Speech sounds broken, forced, or incomplete. Receptive aphasia, Wernicke's aphasia. Speech flows easily, but words may not make sense. Difficulty understanding others. These speech issues can be emotionally devastating, leading to frustration, isolation, and loss of confidence. Studies show that stroke patients with speech disorders have higher mortality rates, making early treatment critical. 2. Persistent or uncontrollable hiccups. Hiccups may sound harmless, but persistent hiccups can be a stroke warning sign, especially in women. When hiccups last longer than 48 hours, appear suddenly without a clear reason, occur alongside dizziness or weakness, pay attention. Why does this happen? A stroke can affect the brainstem, which controls breathing, swallowing, reflexes like hiccups. Damage here may disrupt nerve signals, causing constant hiccups. Many women ignore this symptom because it seems minor, but it can delay life-saving treatment. Supportive tips, not treatment. Stay hydrated. Eat fruits and vegetables. Maintain electrolyte balance. Persistent hiccups plus other symptoms equals seek medical care immediately. 3. Generalized weakness and extreme fatigue. Unlike the classic one-sided paralysis, many women experience full-body weakness. This feels like heavy limbs, extreme tiredness, difficulty doing simple tasks, feeling drained even after rest. Why? After a stroke, the brain uses enormous energy trying to heal. Emotional stress and depression can make it worse. Studies show pre-stroke fatigue is more common in women. Recovery support. Protein-rich foods, eggs, fish, beans, lean meats. Physical therapy. Gentle movement and rest balance. Sudden unexplained weakness is not normal. Listen to your body. 4. Nausea or vomiting. Sudden nausea or vomiting without food poisoning or stomach illness can signal a stroke. This happens when the brainstem's vomiting center is affected. Balance centers are disrupted, causing vertigo. Many people don't associate nausea with stroke, which causes dangerous delays. Research shows 12% of women reported nausea as a stroke symptom. Soothing, supportive options. Small meals. Bland foods, rice, toast, bananas. Ginger tea. If nausea appears suddenly with dizziness or confusion, get help fast. 5. Shortness of breath. Difficulty breathing during a stroke may result from brainstem damage, weak breathing muscles, disrupted respiratory signals. You may notice shallow breathing, rapid breaths, breathlessness with little effort. Persistent shortness of breath is a medical emergency. Medical care may include oxygen support, breathing therapy, pulmonary rehabilitation. Never ignore sudden breathing changes. 6. Seizures. After a stroke, damaged brain tissue may trigger abnormal electrical signals, leading to seizures. These may appear as full-body convulsions, staring spells, confusion, muscle twitching. About 12% of stroke survivors develop seizures within 5 years. Doctors often prescribe anti-seizure medications to stabilize brain activity. Any seizure after sudden illness requires urgent evaluation. 7. Pain in the face, arms, or legs. Stroke-related pain can feel burning, tingling, sharp, triggered by light touch. This condition is called central post-stroke pain, CPSP. Another cause is muscle spasticity, where tight muscles become painful. Helpful anti-inflammatory foods. Fatty fish, walnuts, flax seeds, turmeric. Pain without injury deserves attention. 8. Hearing problems or ringing in the ears. A stroke may affect the brainstem's auditory pathways, blood supply to the inner ear. This can cause hearing loss, ringing, tinnitus, balance issues. Auditory rehabilitation can help retrain sound processing. Sudden hearing changes equals medical check needed. 9. Fainting or loss of consciousness. When blood flow to the brain drops suddenly, consciousness may be lost. Awareness becomes impaired. Some women experience mini strokes, TIAs, serious warnings of future strokes. Women often present with non-traditional symptoms like fainting or disorientation. Brain protective habits. Omega-3 rich foods, leafy greens, antioxidant-rich berries. Fainting is never nothing. 10. Unusual behavioral or mood changes. A stroke can change personality by damaging the frontal lobe. Possible changes: irritability, anxiety, depression, impulsiveness, aggression. These changes are often hardest for loved ones. Helpful lifestyle support: walking, yoga, swimming, gentle exercise. Exercise boosts mood-regulating chemicals in the brain. Daily habits that may increase stroke risk. Let's talk prevention. 1. Poor diet. Processed foods, excess salt, sugar, and unhealthy fats increase risk. 2. Physical inactivity. Sedentary living raises blood pressure and weight. 3. Smoking. Damages blood vessels and promotes clots. 4. Excess alcohol. Raises blood pressure and triglycerides. 5. Poor stress management. Chronic stress fuels unhealthy coping habits. 6. Inadequate sleep. Poor sleep raises stroke risk. 7. Ignoring health conditions. Uncontrolled diabetes, hypertension, and cholesterol are dangerous. 8. Dehydration. Thickens blood and increases clot risk. 9. High salt intake. Major contributor to high blood pressure. 10. Neglecting mental health. Depression and anxiety indirectly raise stroke risk. Recognizing unusual stroke signs in women can save lives. Strokes don't always announce themselves loudly. Sometimes they whisper. If you notice anything sudden, unusual, or alarming, seek help immediately. Remember, time is brain. Every second matters. Have you or someone you know experienced any of these symptoms? Tell us in the comments. Your story may help someone else. Thank you for watching. Like, share, and subscribe to GissHealthyTips TV, where your health always comes first.